Hi, I'm Camille Mendoza and my ID number is 375139 and I'm going to do my lab assessment now. So first what I'm going to do is I'm going to check the doctor's order. Today I'll be caring for Justin Way. So Justin Way, hospital ID number 1000405222, date of birth November 21, 1982, patient goal of care is R1, admitting diagnosis multiple trauma, and I know that patient has tracheostomy, so I would observe for nonverbal response and allergies none known. And today I'll be doing abdominal wound packing. So as per doctor's order, irrigate abdominal wound with 0.9% sodium chloride, pack abdominal wound with 0.9% sodium chloride, soak half-inch fine plain packing strip once a day and as needed. So before I would gather my supply, I would check the previous documentation to give me an idea on what to expect on the wound. Is the wound healing? How much drainage was there from the last dressing? And how much packing strip will I need? And I'm going to check for patient comfort levels. I'm going to check for pain. So 30 minutes ago, I went to the patient room and checked for pain, and patient already took pain medication, so it should be working by now, but I'm still going to assess pain before I start the procedure later on. So now I'm going to gather my supplies. So I'm gonna need an irrigation solution and a packing strip. So what I have here is 0.9% sodium chloride for irrigation. It is open today at 800 hours, so it is within the 24 limit. Solution is clear, there's no precipitation, and expiration date is 2021, so it is good to use. So I'm just gonna do my med check here before I forgot. So as per doctor's order, irrigate abdominal wound with 0.9% sodium chloride, pack abdominal wound with 0.9% sodium chloride, soak half-inch white plain packing strip once a day and as needed. So I have in my hand sodium chloride 0.9% to irrigate and pack Justin's abdominal wound today at 1800 hours. As per doctor's order, irrigate abdominal wound with 0.9% sodium chloride, pack abdominal wound with 0.9% sodium chloride, soak half-inch white plain packing strip once a day and as needed. So I have in my hand 0.9% sodium chloride for irrigation and packing of Justin's abdominal wound today at 1800 hours. And third check, as per doctor's order, irrigate abdominal wound with 0.9% sodium chloride, pack abdominal wound with 0.9% sodium chloride, half-inch wide plain packing strip once a day and as needed. And I have in my hand 0.9% sodium chloride for irrigation and packing of Justin's waist abdominal wound today at 1800 hours. So that's 3 check. I also have here a half-inch by 5-yard sterile plain packing strip. It is not open yet, and expiration date, I don't see any on the bottle, so I shouldn't be using it, but for the purpose of this lab assessment, I'm still gonna use it. So I'm gonna do my checks now. So as per doctor's order, pack abdominal wound with half-inch wide plain packing strip once a day and as needed. I have in my hand a half-inch by 5-yard sterile plain packing strip to pack Justin's abdominal wound today at 1800 hours. As per doctor's order, pack abdominal wound with half-inch wide plain packing strip once a day and as needed. So I have in my hand a half-inch by 5-yard sterile plain packing strip to pack Justin's abdominal wound today at 1800 hours. And third check, pack abdominal wound with half-inch wide plain packing strip once a day and as needed. So I have in my hand a half-inch by 5-yard plain packing strip to pack Justin's abdominal wound today at 1800 hours. So that's 3 checks. I'm also gonna need one dressing tray. So I have here a dressing tray that is intact, dry, never been opened, and expiration date. I couldn't see any expiration date on the tray, but for the purpose of this lab assessment, I'm still gonna use it. I'm also gonna need 2 2x2 packs, and it is dry, intact, never been opened, so it is good to use. I'm also gonna need a 4x4, and again it is intact, dry, never been opened, good to use. I need a blue pad. I need a sterile applicator tip and a sterile scissor. So looking at the packaging, it is dry, intact, never been opened. And expiration date, I don't see any on the packaging. But again, for the purpose of this lab assessment, I'm still gonna use them. I need a adhesive to secure the dressing, tape to put the date and time on the dressing, tape measure to measure the wound. I'm also gonna need a sterile glove. So what I have here is a micro touch sterile glove. It is intact, dry, never been opened, and expiration date is 2021, so it's good to use. And I'm also gonna need a 35 ml syringe with 19 gauge angio-cat needle. But since I don't have that in my supply, I'm just gonna use this 60 ml syringe with catheter tip. It is intact, dry, never been opened, and expiration date is 2024, so it is good to use. And lastly, I'm gonna need clean gloves. So now that I have everything, I can enter the patient room. Knock, knock, knock. Hi, Justin and Camila. I'm a student nurse. How are you today? Is that all good? Yeah? All right. That's great. So I'm here to your abdominal wound. So what I'm going to do is I'm going to change the dressing and I'm going to cleanse the wound. Is that okay? Yeah? All right. So before I start here, I'm just going to take a look at your ID band. So Justin Way, date of birth November 21, 1982. Date of birth November 21, 1982. Thank you, Justin. So I identified that I have the right patient, so I can proceed. But before that, I'm going to check for patient safety. So check for bed breaks, put one sardine up, and provide privacy by closing the curtain or closing the door. And I'm going to raise the bed to my working height. Justin, I'm just gonna raise your bed to my working height. Is that okay? All right. Before I start, I just have a couple of questions for you. Do you have any allergies, like to latex or shellfish? No? Okay. And do you have any pain right now? No? Okay. So I also check for signs of pain. So looking at the patient pace for any grimacing, and I don't see any. There's no restlessness. There's no guarding on the abdominal wound. So I'm good to proceed. Okay, Justin, is it okay if I lift up your shirt so I can take a look at the wound? Thank you. So I'm going to just lift up I'm just going to put the cover on the side. So I'm looking at the old dressing. It was put on April 5th at 1800 hours. So I'm going to change that today. Alright, Justin, I'm going to take off the old dressing now, okay? I'm just gonna wear my clean gloves here just to protect myself from any body fluids. So I'm going to lift up the dressing towards parallel towards the wound, just like this. And I'm going to just lift it off slowly. I'm not gonna rip it off of the patient's skin. And I'm going to take the dressing off away from my patient's line of vision. I'm going to take it one by one. Okay, so what I have here is two 4x4 gauze soaked with approximately, I would say, 40% of serous drainage. Color is bright, so I know that it's fresh blood. And consistency looks clear to me, and odor, I don't smell any foul smelling odor. And I'm going to take the packing strip. As per previous documentation, I should have in my hand a 39 centimeter long packing strip, and that is what I have right now. It is 100% soaked with serous drainage. Color is bright, consistency is thin, and I don't smell any foul smelling odor. So I'm just gonna crumple that in my arms. And I'm going to do my wound assessment here. So Rita, so looking at the wound edges or peri-wound, I don't see any redness or increasing redness. There's no ecchymosis or bruising as well. And upon light palpation, I don't palpate any swelling or edema, and drainage already did. And approximation, looking at the wound, it is not well approximated. So what I'm gonna do is I'm going to measure the wound length and width. So length would be head to toe and width would be side to side. I'm just gonna do hand hygiene here. I'm gonna take the tape measure, and length is 5.5 centimeter and width is 5.8 centimeter. So I'm just gonna record that, and I'm going to document that later. And for the depth of the wound, I'm going to measure it later once I'm done irrigating the wound. Alright, Justin, I'm just gonna put a blue pad under you so we can protect your beddings from getting wet. Is that okay? Can you lift up your right side for me? Thank you. And is it okay if I put some of my stuff on your bed? Thank you. Are you comfortable enough with that position? Yes? Okay, great. And I'm going to wear gloves, cubby wipe the table, take off the gloves, and I'm going to raise the table to my waist levels, as anything below waist level will be considered contaminated. Hand sanitize before I open the dressing tray. So now I'm going to open the dressing tray towards me, making sure I'm not cross-contaminating. And I'm keeping the sterility, as any contamination would lead to complications like infection. So what I'm doing here is I'm just taking the upper strip, step back, and I'm just touching the 1-inch border around the drape to keep sterility. And I'm going to put the shiny part down. Gonna grab my tray again. I'm gonna take my second drape here. I'm just gonna put this aside for some extra absorbency. I'm also gonna take the garbage bag. And I'm gonna put my tray down. I'm gonna put my forceps here. And I'm going to take my gauze. I'm gonna open it using the banana peel method. And I'm going to take the dressing nice and straight. I'm gonna go in, out, my forceps down. And I'm gonna do that with the rest of my gauze here. How are you doing, Justin? Are you still doing okay? Okay. So nice and straight out. Go in, out, put it down. And I'm going to take my applicator tip. I'm going to do the banana peel motion again. Take my forceps, and I'm going to take it out, making sure the tip isn't touching anything. And I'm going to put it on my sterile field. And I'm going to take my scissors as well. Next, what I'm going to do is I'm going to take my normal saline, and I'm going to pour at least 60 to 100 ml of irrigation solution. I think that's enough. I'm gonna place this aside and I can start irrigating the wound. Just gonna hand sanitize here, and I'm going to wear clean gloves to protect myself from any splashes when I'm irrigating the wound. Alright, Justin, I'm going to start irrigating the wound now, okay? If you feel any discomfort or any pain while I'm doing the procedure, just let me know. Don't hesitate to stop me, okay? So I'm just gonna open my syringe here. So ideally, I would have used 35 ml syringe with 19 gauge angio cut needle. But since I don't have to get the right PSI, but since I don't have that in my supply, I'm just gonna use this 16 ml syringe. Now I'm going to take at least 60 to 100 ml of irrigation solution to effectively irrigate the wound. Alright, Justin, I'm gonna start irrigating now, okay? So I'm going to irrigate just the wound bed with the zigzag motion until the debris comes out and the drainage runs clear. So I would need at least, again, 60 to 100 ml of irrigation solution. And now that I see that the drainage is already clear, I think that's enough. I'm going to take off my gloves. And hygiene. And I'm going to take my packing strip. I'm gonna open it. I'm gonna lay the cup upside down to keep sterility. And I'm going to just set this aside for later use. And then I'm going to take the sterile gloves. Alright, Justin, I'm just wearing my sterile gloves here on your side. So I'm going to grab the first gloves, making sure I'm only touching the inside. I'm going to fish out the second one. Now that I have my sterile gloves on, everything that I do at this point should remain sterile, as again any contamination would lead to complication like infection. So what I'm gonna do is I'm going to take my sterile scissor. I'm going to take my sterile forceps. I'm going to take 39 centimeter long packing strip. Again, I'm making sure I'm maintaining sterility. And I'm going to soak it with my normal saline. I'm going to place my scissor back on my sterile field just in case I'm gonna need this later. And I'm gonna start cleansing the wound. I'm making sure I'm keeping the tip of my forceps down, as any fluid backflow would cause contamination. So I'm just wrapping the gauze on the tip of my forceps, and I'm going to cleanse the wound edges using 3 concentric circles. So from the center going outwards, discard. I'm making sure once I go around, I'm just gonna go around once and discard the gauze. Just going around once card. And I'm making sure I'm not pressing hard or rubbing on the wound edges. I'm just going around it lightly. And now I'm going to dry the wound with my gauze. I'm just gonna put this above the wound bed to absorb some of the irrigants from earlier. I think I'm gonna need one more. So I can choose to air dry it just as long as the wound bed and the peri wounds are dry for the adhesive to stick on. I'm just gonna need one more. Okay, I'm gonna place it back down on my sterile field, and I'm gonna take my applicator tip, and I'm going to measure the depth of the wound. So looking at the wound, I don't see any tunneling, and the depth is 1 centimeter, so I'm going to record that later. Now I can start packing the wound. Alright, Justin, I'm almost done here. How are you doing? Are you still doing okay? Alright, great. So now I'm going to pack the wound using the xylophone method, so back and forth method, and I'm just using the forceps to guide where the packing strip is going, and I'm packing the wound just enough to cover the wound bed. And I'm making sure I'm not pressing hard on the wound bed. Now that the wound is back, I can take my 2 4x4 gauze. I'm going to cover the wound. At this point, sterile step of this procedure is done, but I'm just gonna keep my sterile gloves on. I'm going to take my knee fix. I'm going to secure the wound, making sure I leave an inch of the border around the dressing. Alright, Justin, I'm done. I'm just gonna put an adhesive on your dressing so we can secure it. How are you feeling? Do you have any pain right now? No? Okay, great. So I'm just gonna put this on. So while I'm doing this, I can give my patient some teaching. So Justin, I just have a few things for you to keep in mind and some teaching. So if you notice that the dressing feels off, or there's too much drainage on the dressing, it is important that you let us know. And if there's some increasing pain or unusual pain around the wound, or there's some warmth around the wound, you should let us know too. And I would encourage that you increase protein, vitamin A, and vitamin C on your diet. So eat foods like lean meat, citrus fruits, and green leafy vegetable, as those food will promote wound healing. Do you have any questions for me? Is everything clear to you? My teaching? Yeah? Okay. So what I'm doing here is just I'm writing the date and time. So April 6th at 800 hours and my signature. So that the next nurse will know that your dressing has been changed. Okay, all the sharp would go to the sharp container. And this will go to the garbage. Justin, if you could just lift your right side for me. Thank you. Garbage. This goes to garbage as well. I'm going to take off the gloves. Hygiene. Alright, Justin, I'm just gonna put down your shirt. And here's the call bell. If you need me, just press this and I'll come see you. But I'll be back in 30 minutes anyway to check on you, okay? Are you comfortable in that position? Do you need anything before I leave? No? Alright, I'm just gonna lower your bed here for your safety. Okay, I'm gonna hand hygiene before I get out of the patient room. Alright, Justin, I'll see you later. I'm out of the patient room. Hand hygiene. And I'm gonna put the date and time of when I open this. And hand hygiene. And I'm done.